As Deputy St Pierre said, we sadly had our fourth death, and once again our condolences go out to the family. What we're going to do moving forward is we're not going to talk about every single death. It's not that they're any less important. Every death, the public health team, and indeed the whole island, feels really acutely, and our condolences go out every time to the family and friends of those individuals. But if we move on and look at where we are, we now have 166 positive people on the island, but encouragingly, we now have 34 people that have totally recovered. And if you recall, we define recovery as the absence of us being able to detect the virus on the throat and nose swab, together with the person feeling clinically well. So most people will have that test on day 14, but if they're not quite well on day 14, we might delay it for a couple of days after that. And we're very pleased that 34 islanders have totally recovered and are completely well. As we've moved on, we've also got more intelligence about the groups of people that are infected. And encouragingly, when we look at our community seeding, now those are people who we've identified infection in through symptomatic testing and who we have no evidence of either travel or contact with a known positive. They're just people that have popped up in the community, and that accounts for less than 10% of cases. So we're getting good intelligence on that, and that's related to our widespread testing. We also are getting very good detection amongst our contacts. So about 25% of our cases are diagnosed in contacts. Now, these are people who we've identified as a contact of a confirmed case. We've asked them to go into self-isolation. They've self-isolated themselves, subsequently become symptomatic. We've then sampled them when they're symptomatic and found them to be positive. Now, this is really hugely important because those people haven't been in contact with the general community. Because they've been in self-isolation, they will have almost no contacts at all. Sometimes they'll have a small number of household contacts. But that is hugely beneficial to stop that chain of transmission. So the fact that we're able to get that data together is really important. We continue to look at our age range, and our age range again goes from under 1 to people in their 90s of people acquiring the infection, and we've got a roughly equal male-female split in the gender of the people getting infection. One of the things I wanted to focus on in more detail today was the issue of masks, because obviously that's very topical. So the World Health Organization issued some new interim guidelines yesterday on the use of masks. And I think the use of masks in clinical settings and in symptomatic people, I don't think that is a matter of dispute. The issue is the use of masks in the wider community in people with no symptoms. And one of the things I'm really concerned about is we must not use the use of masks to lull us into a false sense of security. And that's really important. So if people are symptomatic, I do not want them putting a mask on and saying, great, I can go out, it's absolutely fine. It's not fine. Symptomatic people need to stay at home in self-isolation. So I think that's really important. We also have got the huge advantage of having more data with regard to from our testing program, and that's given us some very useful information. Now, when we've looked at some of the groups of people we've tested, we have found people with little or no symptoms actually coming up positive, and that's really important as we look at how we devise our strategies, what is right for us and our community. Interestingly, some people have very minor symptoms, with the loss of the sense of smell being one of the most common things that we come up with. So that's really important. So then that comes back to the issue of cloth masks. Surgical masks need to be used for healthcare workers and in healthcare settings. There's a worldwide shortage, and we'd ask please for people not to use them in the community when they have no symptoms at all. But if you look at cloth masks, one of the issues I brought up with you before is that if they are not properly used, they can in fact represent a risk to that person. So if you are going to use a cloth mask, you need to launder it properly, you need to tumble dry it, you need to iron it. So all of that is really, really important. So it comes to what our recommendations are, or what our thoughts are with regard to cloth masks. And we reviewed all the data. We spent a lot of time over the weekend and into yesterday evening looking at what the data is. And our conclusion is that we would support people's personal choice to use a cloth mask in the community if that's what they choose to do. And I think that is balanced based on the recommendation. I think people need to be cognizant of the fact that using a mask actually isn't going to so much protect them from infection, but might prevent them from transmitting infection. And I think that is really important. So the public health view is that we'll support a personal choice with regard to the use of cloth masks, as long as people don't use it when they're symptomatic to be out in the community, because that's an absolute no-no, with all the caveats of using it properly and with all the caveats about laundering it appropriately, changing it when it's wet, and so on. So I think that's really, really important. So we feel that's the most balanced approach based on the evidence we have. And I've always sat in front of you and said that we'll look at our advice would be based on the evidence that we can get. So that's our recommendations with regard to that. We're going to continue to monitor the situation, and if anything changes, we will, of course, review the evidence as it comes up.